This is Average Joe PT, where we're here to reduce anxiety, improve function, and master your pain. Now, Scully and I today, we're going to talk about the foot and ankle. And if you are new to this channel, I'd love to have you subscribe down below and be part of our family. But today, we're going to talk about the two main types of sprains that you can have, as well as what happens if you have to have surgery and what type of treatment that you can do at home with those two issues. Stay tuned. There's 4 ranking system for a sprain, 1 through 4. Isn't that right, Scully?
1, 2, 3, 4.
He's so smart. Now, 1 is basically you sprain it, you walk it off in a few days, and you're good to go. Ranking 2, 3, and 4, not so much. Ranking sprain type 2 is you've basically torn that ligament a little bit in the tendons. 3, you've torn them pretty good, they're almost ruptured. And grade 4 sprain is a total rupture. That's right, you've ripped the ligaments right off the bone. Now, which ligaments are we actually talking about? I'm going to bring you up real close. Number 70% is called the anterior talofibular. What the heck is that? Well, when you turn your ankle and sprain on the outside, this is the fibula or the outside bone. This is your shin bone. And so when you touch your ankle all the way down where it sticks out, you're actually touching the end of that fibular bone. So if we kind of turn sideways here and you see that outside, it's that ligament that runs from your fibula to the talus. It's the talofibular ligament or anterior talofibular. And what that really means is that you've sprained, and it's 70% people, that's when they tear their ankle or twist it, that's what they're doing. The other 20%, when you've really sprained the thing, it's also called the calcaneal fibular. So it goes from this heel all the way to this bone. So these two main ligaments are the two ligaments that actually get sprained the most. Grades 2, 3, and 4, it doesn't matter, but those are the two ligaments. Now you can sprain some of the other ones, and then you're in some real trouble then. Now, a type 2 sprain, oh yeah, you're looking at probably 2 months. 2 months of actual therapy of trying to get this thing better. If you do a grade 3, holy cow, 6 months. That's right, it's gonna be 6 big months before you get that thing moving correctly. Now, we're gonna do some treatments that you can do at home to help reduce those symptoms and hopefully get you along this process a little bit faster. Let's say you fracture one of these bones. Let's say you fell, you landed on some car accident, you jumped and you landed wrong. 100 different reasons why you could fracture this bone or any of the little bones. This bone here, there's a lot of small little bones inside this ankle that make this thing move around just right. And so if you fracture a bunch of those, you might actually have what's called a triple arthrodesis. Yes, that's right. It's where they fuse 3 of the bones. And essentially what they do is they fuse this bone, this nice shin bone, against this bone down here. They fuse this bone against the heel bone, and they also fuse this bone against the front. And so basically this becomes one giant joint instead of having all this movement. And so that can cause a lot of problems also, because now you're relying on this Achilles tendon to really help you with all the things. Now I'm going to leave a little pickup here, and that's all about the gastroc soleus, and where the calf muscle, or also known as the gastroc muscle, crosses that knee joint, comes all the way down from the knee, comes down into the Achilles tendon and attaches to the heel. And that's the main one we're going to work on when you want to stretch that thing out so you can get some of this movement back when they fuse it, or if you have a really bad sprain, because that's called tibial translation. What the heck does that even mean? That means is that your shin bone has to come over your ankle. If it doesn't, you will limp. It will feel like you can't come over your foot, and that's what happens. Can't come over your foot. And so we got to stretch out all those muscles and tendons in the back, including the Achilles tendon, and get some strength back in that foot, as well as some sensory, some ability to get you to close your eyes and still be able to hold your balance. So that's the whole sensory component. That's a whole other video. Leave some comments down below if you want me to talk about that. So when we come back to the foot, what you want to do, let's say you sprain it, the first 72 hours, you want to ice it and elevate it. Make sure you're elevating above your heart. I talked about this in my lymphedema video. You want to elevate above your heart. If you're not doing that, you're wasting your time. Ace wrap it. Don't worry about an 8 air cast or whatever. Just ace wrap the thing. nice and tight, just to cut your circulation off. But that'll at least give you some stability while you heal from this sprain. Now, there's another little trick that they used to do a long time ago that I still do every once in a while. It's called a contrast bath. It's where you take some hot water and some ice water, and you have them two separate containers, and you take your foot and you go from one to the other. You hold that for probably about 30 seconds to a minute, and then come to the ice and go back and forth. What the heck are you doing that for, Average Joe? It's so that the blood vessels will open and close. Open and close. What that does is called the muscle pumping and vascular, so you can pull some of that fluid out even faster. So those are two tricks to really reduce the swelling. The ACE wrap and also the contrast bath. Isn't that right there, Scully?
That contrast bath really works.
Yep, he seems to like it. Now what we're going to do now is I'm going to give you some home treatments that you can do to get you going a little bit faster, because boy, that 2 months, that's pretty crazy. Watch this guy. This guy's nuts. He's going to do all kinds of things that you shouldn't be doing at home or out and about, because you're going to sprain your ankle and bust it. This guy, oh yeah, this is me. I've done this. I hope I'm okay. Time for some more treatments. Treatment number 1. You're going to take a towel. Like I said, you want to stretch out the back side of that calf and ankle. So you're going to put your foot just like that, supporting the entire foot. And you're going to hold that for a good 30 seconds to a minute, and then relax, rinse and repeat. It should not hurt. All you should feel is a pull on the back of the leg. If it starts to hurt on the outside of your ankle, you're pulling too hard. Ease it up a little bit. So that's stretch number 1. Pretty simple to do. Next one you want to do, if you can, get yourself a rubber band. I'm going to show you some real quick treatments for this, and then I'm going to show you if you don't have a rubber band. First one, just kind of pull out, in and out. This one, if you've seen any other physical therapy clients, you've seen this one. You can put your other foot in, and now all of a sudden you can go out to the side. That's where you're going to be weak at anyways, is pushing down and pushing out to the side. So you can do it that way, or take the band away and just use your own body resistance for the actual strengthening part. So what you want to do, I'm going to pop out. You're just going to see my feet. Here I go. Woo! And all you're going to do is go up and down. Now I got really good balance, so if you need a chair or something, you can do it like that. And you want to come up. This is a good strengthening exercise. Now you can come up and try and walk or just step in place and see if you can keep both of those really high. Now, if that's too easy for you, you can go ahead and try it on a pair of steps. Stay tuned. Hello, world of YouTube. All right, I'm going to show you this. It's pretty simple on steps. I got a railing so I don't break my rear end. Here we go. Up and all the way up and then back down. All the way up and then back down, nice and slow. Any type of strengthening you want to do, you always want to do it where you're coming down nice and slow. Don't go up and down really quick. That's the smart one. Now when you do this, I would only do like 10 or 15 of them. Don't do too many of them because you don't want your ankle to be too sore. Remember, you just got over spraining the dumb thing. So let's go ahead and show you one problem that you can have with either a sprain or a surgery after having a foot problem. Boom, we're back. All right, this last problem that you can have, whether you've had a surgery or whether you've sprained it, it's good old bottom of your foot. It's called plantar fasciitis. Now, I'm going to leave a little tab up here. I went over plantar fasciitis moons ago. If you guys have any questions about that, just look at that tab. That goes over some nice techniques that you can do. But what the heck is plantar fasciitis, or fasciitis as some people might say? See that little thick little thing right here from the heel all the way up to the foot? That's right, that dumb thing can get inflamed. It can have heels, you can get all type of spurs, heel spurs or whatever spurs within this thing, calcium deposits, whatever you want to call it. But that's a main secondary problem that you can have if you've sprained it or you've had surgery. So be mindful of that. You might not only have an ankle problem, you might also have this little problem too. So go ahead and you can go ahead and tag on that baby after this, and you can go ahead and look over that, and maybe that can give you some more helpful hints of different techniques that you can do at home to help your ankle sprain, or if you had ankle surgery. Ain't that right, Scully?
You better stick around if you want to learn those techniques.
We're gonna be right back. Hang in there. Scully and I would love to have you guys as part of our family. So subscribe down below, hit the bell so you don't miss any of our content. I try and bring content once or twice a week. Do a nice, Scully.
1 or 2 times.
That's right. right. We bring content once or twice a week as much as we possibly can to help improve your function, reduce your pain, and reduce your anxiety. So, I'm going to leave a little tab up here in this corner that goes over some other nice little content that you might want to look at, maybe some information for family or friends to help also master their pain. But until next time, I want you to look up and keep smiling. Ain't that right, Scully?
Keep smiling.
He said it. See you next time.